Oh, hi! I didn't see you there. I'm Dr. Pettis. You caught me studying elephant ears, which is interesting because this week we're going to be dissecting the pharynx, larynx, and the ear. I'd like to brief you a little bit to get ready for the pharynx, larynx aspect of this dissection because I know you have an exam right before lab and don't have time to prepare. So I'm going to point out a few key features that'll help orient you in this dissection. Hey, just follow me over here. My fellow anatomists, I can recall when I was an anatomy student, I saw pictures like this and I thought, gosh, that netter sure is imaginative that he can visualize and illustrate the posterior view of the pharynx, for no one would ever see that because it lies against the prevertebral muscles and the vertebral column. And then I got to lab. So I want to warn you, when you get to lab tomorrow, to save time, we're going to do the first step of this dissection in the morning so it's ready for you. And that will be disarticulation of the head from the vertebral column. And it will still be connected to the pharynx, larynx, and trachea. And we're going to pull it forward. It'll be as if it's on the chest, and you'll be seeing this posterior view here. How about that? So there are several things I want to talk about, but it's not starting right here. So let me switch slides. So I know you all are scholars in the layers of the fascia of the neck. I want to make sure you are refreshed on one aspect in particular. And so if we come on over here, we can refresh here for a moment. We'll see the investing layer, which is around these more superficial muscles. You'll see the prevertebral layer, which is around the vertebral column and these intrinsic muscles of the neck and back there. And then we've got this, the pretracheal fascia. And remember this space here between the pretracheal fascia and the prevertebral. Let me go to the next slide to show you this. So same picture, but I want you to see the retropharyngeal space. So when you were, the previous slide, 2 slides previous, when we were looking at the posterior of the pharynx, that would be the view as if we're in the retropharyngeal space. So see, we're going to disarticulate the head from the vertebral column and pull it forward. And this space right here, which is just really, we attach the pretracheal fascia to the prevertebral fascia with a very loose, breakable connective tissue. So you'll see that it just pulls forward with almost no attachment. And then we'll have this posterior approach to the pharynx. It'll be fun. Now, our first dissection involved the lungs and the thoracic cavity. And we looked at a little film about the respiratory system. And today we are going to investigate the pharynx and larynx and a little bit of trachea and learn some of these other aspects of the respiratory system. And next week, we're going to come back and study the nasal and oral cavity as well, but primarily nasal cavity for the respiratory system. This is the way it works. The air comes in the nasal cavity, and at that point, hopefully it's just air. As we come down behind the nasal cavity, we have the pharynx. And we're going to see subdivisions of the pharynx in a moment, but it's got a part behind the nose, behind the mouth, and behind the larynx here. But we've got air here. Once we get to the level of the mouth, you can see food would be mixing with it. So we've got this passageway at this point that is going to involve food and air and tequila, depending on what you're doing. So you'll find that the epithelium is ready to handle Tabasco sauce and tequila. And then the respiratory system and the digestive systems will separate. And there's some better slides for seeing that, but you can just see that the respiratory system continues to the lungs here. We've already studied that. The nasal cavity, oral cavity below that, below the palate there. And if we are air coming in the nostril, going through the nasal cavity, the posterior border for the nasal cavity is called the cona. And behind that, posterior to that, we are then in the pharynx. And the pharynx travels all the way down here to just below the larynx. It's divided into 3 spaces depending on what other cavity you're next to. So you can see that behind the nasal cavity, we call it the nasopharynx. Behind the oral cavity, we call it the oropharynx. And behind the larynx, we call it the laryngopharynx. And at this point, we also, so this part here, as I said earlier, the oropharynx and the laryngopharynx, you're carrying both food and air. So you're, respiratory and digestive, mixed area here. Below this point is where we separate one of our categories, the upper respiratory and lower respiratory. So once we go into this, exclusive respiratory zone, sort of a gated community here through the larynx down to the trachea and the lungs, that's all lower respiratory. So you've heard your whole life people talk about, I've got an upper respiratory infection. It seems to be always where it begins. I feel like a sore throat up here when I get a cold. Alrighty. There are 6 pharyngeal muscles we'll be looking for. 2 groups of 3. First, you have the 3 constrictor muscles. So these are more like muscles that circle around the pharynx. They're more like C-shaped, actually. So they are defined by where they attach. So let's start inferiorly here. The inferior constrictor, we can see it from the posterior view right here. Here's our inferior constrictor, here's our middle, and our superior constrictor. And you can see they fit inside each other like, solo cups. Think of red solo cups, stacking them inside each other. So they slide down, and you can see how they overlap quite a bit there. The inferior attaches to the laryngeal cartilages, the thyroid and the cricoid cartilage. The middle attaches to the hyoid bone, and the superior attaches to the pterygomandibular raphe. That's the constrictor muscles. Then we have longitudinal muscles. Let's see, I think I'll only get one of them in this picture, but we have other pictures. So you can see some muscles coming down from the skull into, and then they blend in. These fibers come in and blend with the constrictor muscles. The one coming from the styloid process is called the stylopharyngeus muscle. That's right. What other muscle have you learned about coming from the styloid process? Oh, you have. That's right, the stylohyoid muscle, which comes down here to the hyoid bone. And you're going to learn another one that goes to the tongue next week. That'll be the styloglossus. But for right now, the stylopharyngeus muscle, which is innervated by the glossopharyngeal nerve. That's the only muscle that nerve innervates. This is the larynx. Several of these words to do with the skeletal elements of the larynx will be thrown around as if they are part of your vocabulary tomorrow. So let's get a good feeling for these. You know the hyoid bone already. The thyroid cartilage is the part of the larynx that is easiest to palpate. The Adam's apple, particularly on males, you would feel down here. The thyroid cartilage articulates with the cricoid cartilage. So this thyroid cartilage is actually shaped like a shield. It's not a complete circle. And the cricoid cartilage is actually a ring. And we say it's like a signet ring because it's thin in the front and thick on the back, like when your college or your high school ring. And when in the trachea, those are C-shaped cartilages. So this is the one that's the complete circle, the cricoid cartilage. And the epiglottic cartilage there. Now, this is the netter, magically translucent thyroid cartilage. So we can actually see behind it these triangular arytenoid cartilages. And these rest on the wide part of the signet ring that is the cricoid cartilage. So the arytenoid cartilage articulates with the cricoid cartilage, and they are a pair. Everything else I said so far was singular. Hyoid, one thyroid, one cricoid. We have a pair of arytenoids. And see this little angle, see how it's triangle shape? We're going to learn about the different angles, but for right now, just know that this angle right here actually anchors the vocal folds or the vocal cords. So they stretch from the arytenoid cartilage to here on the thyroid cartilage, so the inside of that thyroid cartilage there. We've seen lots of pictures that show that well. One more thing to show you. The hyoid bone, thyroid cartilage, this membrane right here, this is your thyrohyoid membrane. We named that nicely. You know, if you learn your bones and your cartilages, this membrane just comes into nomenclature there. Now see there's a little hole on each side. You're going to identify the nerve and the artery that go through that. It's going to be called the internal laryngeal nerve and the internal laryngeal artery. I'm sorry, superior laryngeal artery. This is the posterior view of what we're looking at. And so here's this wider part of the cricoid cartilage. Here's the, you can see the more C or shield shape of the thyroid cartilage there, and the relationship of the epiglottis and hyoid bone, thyrohyoid membrane. But what you can really see better in this view is the triangular arytenoid cartilages and how the vocal cords extend from the vocal angle to anteriorly to the thyroid cartilage there. Okay, and I'm going to throw this in for good measure because it's something that I can usually say in class. Please pay attention. I'm going to ask you this in lab, and somehow people miss it, and it's not difficult. It's just, you know, names again. So let's back up. Sorry. So we have the vagus nerve running through the neck down from the skull. We've already seen that and identified that. We might have seen this as well, the superior laryngeal nerve. Actually, you probably didn't see this. You might have said you saw it, but what you probably saw was one of its branches. The superior laryngeal nerve bifurcates, and it's highly likely we have not seen this yet, but have seen its branches. So the branches are first, the easier one to find. The internal laryngeal is the one that goes through that little hole you saw in the thyrohyoid membrane. And that nerve is responsible for sensory, somatosensory perception in the larynx above the vocal cords. Your old friend, the recurrent laryngeal, does it below the vocal cords. The other branch, of course, if you got internal, the other one's going to be external. The external laryngeal nerve, it travels down sort of between the trachea and the esophagus. So it's further posterior than you probably think. And then I'm sorry, not between the trachea and the esophagus, but between the larynx and the esophagus. It's pretty far posterior along the larynx. And then it branches anteriorly to innervate the cricothyroid muscle. So that's a motor nerve. And there you have it. That brings us to the end of our Cliff Notes preparation.